You are listening to another episode of the Business of Aesthetic podcast series brought to you by our gold sponsors, MRP and Equa Marketing. We also want to thank our silver sponsors, iLeaseWorks, ProNox, and Lengia Law. If you would like to network and share your experience with our podcast guests and other aesthetic industry professionals, join our Facebook or LinkedIn communities by searching for Business of Aesthetics.
Get ready for an extraordinary opportunity. You're invited to join our exclusive monthly webinar, brought to you by the Aesthetic Institute and the Business of Aesthetics community. Don't let this chance slip through your fingers. Secure your spot now for a game-changing experience. Explore the details on our homepage at www.businessaesthetics.org and get set to transform your strategies.
Welcome to another captivating installment of the Business of Aesthetics podcast. My name is Dana Zeitler. I'm a physician assistant and med spa owner in Naples, Florida. Before we immerse ourselves in the riches of today's episode, I want to take a moment to express our gratitude to our incredible listeners. Your willingness to embrace and share this podcast allows our community to grow and serve others. Your unwavering dedication is the cornerstone of our success, and we can't thank you enough. So today I want to welcome Dr. Joelle Lieman. Dr. Lieman is a founder and medical director of Elite Med Spa and Wellness in Needham, Massachusetts. She is a board certified OBGYN, a sought after amazing Galderma Gain trainer, speaker for Benev and other industry leaders. For over 20 years, she has been a leader in the aesthetics and sexual wellness field. She has grown her current practice to now include a very busy training center for other providers. So welcome and thank you for being here, Joelle. I am excited to have you here today.
Thank you, Dana.
So let's jump right into it. I do want the listeners to learn a little bit more about your background as a gynecologist and how you transitioned into aesthetics and what inspired you to open the training center for, PRP and sexual wellness.
Well, first of all, what a beautiful intro, and thank you so much for thinking of me. I'm often asked about the transition, as that is unusual for some. I think as aesthetics grows, we definitely see different types of physicians and nurse practitioners and PAs. But for me, I think it was a combination of one of the partners in my OBGYN practice. It was a very large practice, actually was doing botulinum toxin injections. And at the time, I obviously was getting to the age where I needed it too. And I asked her how she added that to her practice. And it just became kind of fate for me because she stopped doing injectables and I have a great interest in them. Not only because I wanted them for myself selfishly, but truly I found that my artistry, I'm a very, very creative person. I love being a surgeon and I felt like my creativity just flourished after starting to do filler injections and tox injections. And from there, at the time, it was actually body contouring that they were really pushing for the gynecologists and the obstetricians to start, at the time it was Zeltique owned, it was Cool Sculpting. And they approached me talking to me about adding this service. And because the machines were so large and I felt as though my practice, although it was pretty, it's not as pretty as an aesthetic medical spa, wasn't the right place for it. And I had slowed down in doing obstetrics, mostly because of my lifestyle. It is a very difficult lifestyle to raise 3 busy children. And it just was a dream. One night I was saying to my husband, I'd love to open my own little spa. And this was before there was one on every block, which there is now, especially in the Boston area. And I kind of went with it. I actually didn't have a business plan, wasn't the smartest way to do it, but we were profitable on day one. And within a year of practicing, I started hearing a lot about PRP and regenerative medicine. And it's where my 2 worlds just came together when I heard about the O shot. So I feel like now, I mean, I have been doing this for 10 years now, and I feel like part of why I've transitioned a little bit, not fully transitioned, but we have other injectors working for us at Elite, and I love teaching. And as you know, when you're in the medical field, you learn one, see one, do one, teach one. That's how it all works. And I absolutely love teaching. So now all my worlds have come together. So I'm still definitely practicing. I do injections 3 days a week, and my other days are mostly either teaching at our academy or administrative, because there's so much to do when you're running your
Yes.
own practice. But I think that's my long-winded explanation for how it all happened. It wasn't so organized. I feel like of late, I've taken more of a deep dive into my business because we've grown so rapidly. Now I need to understand a little bit more about having larger staff means more potential issues. And just being able, we have a much larger space. We went from a very small 1,000 square foot space, and now it's 4,000 square feet. So that has its own issues. So I feel like in the last couple of years, especially after COVID, really have delved into the business aspect a little bit more thoughtfully than I did after just that one night where I said, oh, let's open a med spa and we'll see how it goes.
So how much, like what percentage of your spa would you say is sexual wellness? Because I know it's a pretty big part of your training that you do, but you also train for Sculptra and all of these other things.
So percentages, it's not as common per se as doing injectables for the face. However, I've trained my 2 injectors, and I would say definitely weekly, each one of us will have a sexual wellness type of treatment. So whether it is treating someone for vulvar atrophy and doing filler, or doing simple O shots and P shots, we do treatment as well. And then we have a radio frequency device for tightening and atrophy. So I feel like on the whole, I'd have to quantify what the percentage is, but we definitely have patients weekly that we're treating. It is a big part of our practice. And also I think we're lucky in that when people look for an O shot and they see, oh, there's a gynecologist that actually does it, they feel a little bit more secure about that. So we do have a larger population probably than the surrounding med spas.
Yeah, well, when I see you on TikTok and I forget what your handle is, but it's like the sexual wellness doc or something like that. Correct. What is the handle on
Well,
your?
I'd love to tell you what it is, but I have been asked by my teenage
Oh,
sons
to not mention it.
to stop using that.
Oh,
So I did start one that said the sexual wellness doc, and one of my sons is 19 and in prep school in New York, and it's an all boys school. And he's like, do you know how embarrassing it is that that's your name? And I said, well, it's paying for your school. So
there you
maybe
go.
we should, right, exactly. No, I have 3 handles. One is it's just at Dr. Joelle Lieman, and that's my personal /work. And then our med spa is at My Elite Med Spa. And then the academy is at My.Elite Academy.
That's a lot to keep track of. You're right. It's a lot of growth. So tell me, I think based on, some of our conversations in the past, you kind of have been able to market, but I know there's some sensitivities about marketing sexual wellness on, Google and social media. Can you tell me some of the things that you have to think about of, just like you didn't want to say the word because of your son? Do you need to watch out on Instagram or Facebook about how you market sexual wellness?
Yes, and it's actually a really good question because I keep learning as I go. One of the issues when you're doing PRP for sexual wellness, I believe it is constant contact, but I may be wrong. I would have to check on that. But I know, you can say PRP for internal use for sexual wellness, but one of them has an issue with saying vagina. So when you're advertising within, and we use both Constant Contact and MailChimp at different times for emailing our own patients. The other issue is Google AdWords. And if you're working with a company, I'm sure no one's doing their own Google AdWords. You have to be very mindful of what language you may use and may not use. I definitely think insurance can become an issue because our insurance provider has absolutely no issues at all, but being trained appropriately. The disclosure is I do teach for CMA, which is the Cellular Medicine Association. And that's headed by Dr. Charles Runnels, who's the founder and creator of the O-Shot and P-Shot. And he has a fantastic plethora of information about where you can advertise, what you can do, what you can't do. He has a lot of legal help. And I always say to people, rather than paying for, when they take my course, rather than paying for Google AdWords, which can be upwards of $1,000 monthly, you pay him $97 to use his trademark, and then you have access to all of that for $97. It's completely worthwhile. In fact, at one point when I was doing the injection, I stopped paying him and tried to do it myself and went back to paying him because it just was so much less expensive. And you need to have a group, right? This is why you and I are having a call right now. We need to surround ourselves as CEOs of these practices to have support, whether it's legal or information sharing. But I definitely think it's, a little plug for CMA, but I do think it's worth every dollar spent.
I'll ask the podcast Business of Aesthetics, maybe they could link that when they post this video, or when they upload the podcast. So talking about kind of all of the legal things and the challenges of bringing it on, what are some of the best benefits that you consider a reason for a practice to bring this on, of the profitability and offering patients such a dramatic life change of helping them? So can you speak to that?
Yeah, I'd be happy to. I mean, the truth is we experience this every day. Let's not talk about it sexually. Let's talk about it in terms of needing a blepharoplasty, right? If you were able to, both legally and you had the device to do a blepharoplasty, why would you want to send that out to someone else? These patients, first of all these practices are already doing PRP. So there's no addition at all to anything that they're adding to their practice, other than maybe something to visualize where you're injecting. So
and maybe like stirrups too, probably. Yeah.
I prefer for people to utilize stirrups because obviously visualization is the most important, right? But there are ways around having stirrups. I can also give you a link for a chair that has stirrups because I do link that in my class. But I will say, if you don't have stirrups and you have a PRP mechanism, which almost 90% of us do, then why aren't we putting it anywhere else? Would you not put it in the hairline? Would you not put it on the face? Breast augmentation for just crepiness of the skin. It is such a game changer for our patients. And yes, profitability does make sense, right? We're running a business. So profitability, the ROI on those procedures are better than any other procedure that we do.
Amazing.
It costs maybe, let's say upwards of $100 to $200 for your PRP. And we're charging $1,500 to $1,900 for O shots and P shots. So obviously the ROI is there. I think the most important, and this is a shameless plug for my class, but I don't care if you take my class or anyone else's class, you need a good review of anatomy. We do not want to be sticking needles in places that they shouldn't go. It is a very easy procedure. It's much easier on men, believe it or not, than women, just because anatomically women can look a lot different. And if your background is like an ER nurse putting Foleys in, then you're good to go. You know the anatomy. But just the ROI is great, and you're really helping patients. I mean, that's what we want to do. Why shouldn't somebody feel confident from the inside out? It sounds silly, but it's absolutely true. Women of all ages suffer from incontinence, suffer from atrophy and dryness, low orgasm function. You can cure all those things from a small 2 injections of PRP.
Yeah. So tell me, with the training, so besides the practitioner being trained, talk to me a little bit about how you would train maybe your front desk staff or your medical assistants to, make the patient feel more comfortable talking to you about it, or, asking questions about it. How do you sort of handle that?
Yeah, that's navigation. I mean, you definitely have to navigate that. it's the same as when you're training. We have a medical assistant course as well. And when you're training your medical assistant how to analyze your patient, often they're going into the room first. So asking them not just how's your day, what are you here for? Why are you seeing Dr. Lieman today? What concerns you? They get educated by spending time with you. And I think one of the quickest ways to teach our front staff, especially, is spending time in the consultation with me. I often talk to them about what the procedure is. I've given them a script. The front desk person that works for me is fantastic. She's our patient care coordinator, and she's been with me for 8 years. So she could actually do this podcast without me. But I do think there was a learning curve, and there became a comfort level, especially talking to men. But the funny thing I've learned about treating men versus women, because that was a big mountain for me to climb as a gynecologist, the first time I was treating men, is they are more willing to give you their money and get this shot done. They've done research all night long. We get the calls in or the texts in at about 2 or 3 o'clock in the morning. I'm interested in a P shot. So they're online searching after their ED situation that probably happened that evening. They're frustrated and they want something quick. So those patients are actually easier to book. I've tried a couple different things over the years. Now everybody knows who I am, so it's much easier. But when I first started doing it, I actually sent a survey to my patients. And I gave them information. And I said, there is a procedure that is approved for this treatment. This is what it treats. If you are interested, please send me a private email. And if you're comfortable with an email or a call, check here. The other thing I've done is left small surveys at the front desk but when you make yourself more insecure about having that conversation, they're going to feed off of that. It's just like explaining anything else, right? If you're going to inject Sculptra, they need to do massage 5 times a day, 5 minutes a time. It's how we discuss it. And it's also, now it's a little different because everyone knows I do it. But I think when you're first starting out, I think it's important, just as we add anything at all to our services, that we inform our patients and then see what the interest level is. If you have PRP already, you're not going to lose money by investing in asking your patients if they'd be interested in having that procedure.
Yeah, no, it's true. I have a PRP machine and I've talked to you and I'm like, I need to use it, but I need to come, to your course and
I'll come to you. It's Florida. It's freezing here. I'll come to you. I'll train your whole staff. Everyone will feel comfortable. The other thing is really important is to treat each other.
Yeah.
And you have to get over someone's going to see my vagina. Nobody cares. It's done. Nobody remembers what it looks like. And it also is very quick. It's very comfortable and very quick. So yes, go ahead.
You said that you have radio frequency devices. So do you have any like specific vaginal devices in your practice, or is it just the radio frequency device?
I do have a specific one that I'm having a very hard time getting rid of because the company is now off the market and it was my favorite. So, I have a hard time, but it's gone. That was the Viviv. It was a one treatment. There are multiple other devices that are radio frequency for internal and external use. They do require 3 treatments. Thermiva is one of them. You can use radio frequency microneedling externally. So I'll use Silpherm. I do filler in the vulva for just the atrophy, that skin starts looking a little loose, more rejuvenation.
Interesting. Yeah, because I know that, they had a lot of devices that came to market for the vagina and rejuvenation, and then they seem to have kind of disappeared. And I'm sort of hearing a little bit more talk about devices. So I was curious about your thoughts on that and,
Yeah, I definitely use them, but not nearly as much as I do PRP injection. And the benefit, and when I'm often, when I was at Aesthetic Next and I did the business class, it really is, you don't have to go spend $100,000, $200,000 on a brand new device that only solely treats the vagina. That's not going to it doesn't make sense for good practice, right? But what does make sense, and I'm going to tell you, you're the first person we're going to change your mind, is you already have PRP.
Yes.
So then,
sitting on my countertop.
right. And you can use PRF, you can use PRP. You already have it. So what is the restriction?
Yeah.
What's the limitation?
I guess it's that conversation. It's coming up, having that conversation. Like you said, that's the most important thing. Sending out a survey, having something that brings it up, like makes it easy to talk about, because a lot of times people come in with me and they're, asking about wrinkles and everything else. So I end up not really looking below their neck. Just because I don't know why. That's part of the reason I wanted to pick your brain to
Yeah,
see,
I think
talk about it.
Yeah, and you're not alone. Listen, there's a reason I do these business classes, but I think we all have to stay away from that, because I mean, listen, if I'm teaching on label for sculpture, we're not going to talk below the neck. But I'm sure if you're also a gain trainer, so below the neck, we do sculpture in the elbows and the knees and the abdomen. Why wouldn't you do PRP on the body as well, right? And I'm sure there's people doing PRP on the body, then they can also do it in the vagina, in the penis, and people are so incredibly happy.
Yeah. So talk to me about, I know you said something about insurance do you have to have extra insurance, different insurance, or is there anything in specific that the listeners might need to know about insurance for sexual wellness?
Yes, I cannot speak to every state. I can tell you in Massachusetts, we did need to extend our insurance to add PRP. And the question was PRP. I didn't ask for the different, I should look into that to be able to answer your question. But once you add PRP, that is an additional charge, whether it was asked if it was with regards to sexual wellness. So I'm assuming that was an increase. It probably was incremental, however, because we're using it everywhere.
Right.
That being said, that is 100% state specific.
And I would assume I always have a medical assistant with me anyway, just because that's how I operate my practice. But I would assume for sexual wellness, you'd want to have somebody in the room with you, or what are your thoughts on that?
I do. And again, that's about our background too, right?
Yeah.
So I have always had an assistant, and it's not bougie, it's actually safety. That's part of the reason we started a medical assistant class. In fact, it was so well, we had an incredible number of medical assistants that came to our class and course at Aesthetic Next. It was really interesting. And I'm so happy that people are starting to understand the importance of it. I do really believe that is important, regardless of sexual wellness or treatment anywhere. Somebody to help second in terms of documentation and prepping the room.
I agree completely. I would have two medical assistants. Honestly, when I get busy enough, I probably will, just to get another second room started while I'm finishing in the first room. Just take your pictures for you, increase your flow. But if I show up without a medical assistant and it's just me, if she happens to be finishing up with somebody in the other room, they're like, "Where's Felicia?" Because they make the patient more comfortable. They hold the ice, they hold the vibrator, they chat with them while I'm kind of thinking. They help me with my documentation. I agree 100%. I think having an MA in the room makes me a better provider, and I'm able to listen more to my patient because I'm not worried about all the little stuff. So, highly recommend medical assistants if the listeners don't have them, or if they are on the fence, because I think for me, it makes my practice more efficient too. I don't know about you.
Yeah, and not only efficient, like you're saying, productivity is paramount to your practice, right? You can't employ all these people unless you're making money in the end. But on days, Sarah is my Felicia. So I get the same thing. Where's Sarah? Where's Sarah? I was like, I don't know. I'm pulling my hair out. I got to take your picture. I got to do this. And the funny thing is, if I look at my time when I have Sarah and when I have not had Sarah, if she's been ill or whatnot, I'm so much more productive. I see way more patients. And if somebody needs, that add-on, I'm here for my talks, but can you do my lips? I'm like, sure, Sarah's got the ice, we're ready to go. But that add-on I cannot do. So even that, and then who's running your business? while somebody's numbing. You can answer a phone call or do a quick podcast. So you can't do that if you don't have somebody assisting you. Absolutely.
No, I agree. It was smart to do a class, especially if you've got a good rhythm down, because she makes me 100% better. And if she's on vacation, I'm like, when's she coming back?
Mhm.
And she's not allowed to get pregnant either.
Oh, yeah. Well, there's
No,
that. I think that's
no.
illegal. We can't
Is
say
it
that.
okay? We can't talk about that on podcasts.
But I will say, I think when we go back to sexual wellness I think it's imperative to have somebody in the room.
Yeah.
It makes the patient more comfortable too, right? Because we're not holding ice necessarily, but somebody handing me my instruments and my syringe makes that injection faster. The anxiety level is much lower, because people do get anxious about treating in that area.
Yeah. So what do you think about the growth for the industry for sexual wellness? I know aesthetics industry is growing like crazy, but what are your thoughts for the future for PRP and OSHOT and all of these things in the future? You think it's going to continue to get more and more popular?
Well, if I would say I went to my first aesthetic conference maybe 10 years, 8 years ago, and there was no mention of that. And now I know I'm being hired constantly to speak. But I'm going to LAMCA and speaking on it in March. You can't go to an aesthetic conference now without seeing the word regenerative, seeing anything about sexual wellness. So I think, yes, the whole industry is booming and moving, but I think especially treating patients with their own products and regenerative medicine is huge. And this is a huge part of what we can do for our patients.
Yeah, no, I agree. It's like if you have it on your countertop, let's just open it up, spin it down, and do you need it anywhere else? And make them happy, which is, the whole goal. Like, I like making my patients happy. I know you like making them happy and fixing issues that they are concerned about. So it's just having that conversation. So really great.
Your email from Deluxe should say, did you know see, I'm doing marketing now. Did you know we can put PRP in other places? And explain what that does. Do you leak when you jump?
Right.
Do you suffer from erectile dysfunction? And maybe you start with one gender if that makes you more comfortable. Most of our med spas are mostly women. So maybe start with women, but I'm telling you, when the person that trained me, Dr. Runnels, when he was like, you're crazy not to do men, they will be coming through your door like crazy. And he was right. They really are. And then the other thing is it's a gateway, right? Then they're like, what's Botox? Nobody ever talked to me about Dysport or Botox or whatnot. And then all of a sudden I've got them as anti-aging patients when they really came in for erectile dysfunction.
Well, I think it sets you apart from every other med spa popping up as well, because not everybody is doing it. And I hate to say everybody's doing Botox, but every dentist, every plastic surgeon, but not everybody's doing sexual wellness. So it definitely will give you, set you apart from the competition, I would think.
Yeah, I think the other thing to keep in mind for the listeners is I'm assuming if you're listening to this, you care about your business and you're trusted. Like, I know, Dana, your patients trust you. So if you're saying, I want to utilize this PRP, the same magic that I've been using on your face or your hair or whatnot, and I want to inject it to cure you of these issues that you're having, they will trust you.
Yeah. No, I agree. So I'm going to do it. The next time I see you, I will be doing it. And I think adding, just like you said, adding a couple of survey questions to my intake form, making, a little card. I think that privacy of, hey, if you're interested in this, send me a private email, mention something to make them comfortable to talk about it as well, that I'm open to listening. Have you had this issue? Is this a problem? I mean, I'm in my early 50s, so I feel like I can relate to others that are, I can't do a jumping jack without crossing my legs. I got to do like jumping jacks that cross the opposite direction. I don't know, cross-legged jumping jacks.
Yeah.
So it's something that I think you can relate to my patient. So thank you for that advice.
And I think we have to do one on you first so that you can speak.
Yes, for sure. I'll come visit or have you here. That would be super fun. We would have a great time, I think.
Yes.
So to wrap it up, because I think we're pretty close to time, tell me, do you have any other insights for practice owners wanting to get into this research? Just anything else you'd like to add for the listeners?
I think, because I know you wanted to speak to business, and I think the way I did it was I was lucky and it wasn't as competitive as it is now. This is a phenomenal field, right? I understand why everyone wants to start a med spa. I will say from my experience, it is very, 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 I mean, I did surgery for 20 years. It's very, very easy to inject somebody. It is very difficult to feel comfortable, understand the nuances of injection. And I think education is paramount. I've always felt that way. I would say find a mentor. We're in an industry right now where I think community over competition is a saying we say all the time. Find yourself a friend, a mentor, someone you can, I mean, I've texted you on the side to ask you, how do you pay this person? How do you do this? Because it is so, don't get, what am I trying to say? Don't get boggled down by some people that are cutthroat. Those aren't your people.
Yeah.
Find people that you want to support you. I train people in my backyard. I literally, when I started training for Galderm, I was very insecure about how close should I be to another practice and training them and giving them my secrets. I don't care. I train people within a mile. It's fine. I think that's a better way for all of us to be. There's enough to go around. Everyone has a face and everyone has wrinkles.
Yep.
And I think just finding your commitment to education and your commitment to doing better for the field, staying away from crazy discounts that's only going to hurt the rest of us, or, the Botox party that's not safe. I think we just need to keep elevating the field and make sure you have a colleague to discuss things with, because it's lonely sometimes when you're running a business by yourself and you want to have other people around you that can help you. And I'm one of them. I will help anybody. I'm happy.
I know that. Thank you. Well, that's part of the reason, you're such an open book and you're so willing to serve others and help mentor, mentee your training. So tell us about your training courses, kind of what you offer briefly. I know you mentioned you have an MA class and you have private sculpture training. Is that correct? And what else?
So it's funny because it started really with Sculptra, because we're apparently #1 in the New England area, which is like, woohoo, I guess I do a lot of Sculptra. But I was doing the Center of Education classes, which are huge. They were like 40 people would come in, and that was through Galderma, and people would come to me on the side and say, well, I want to learn temples and I want to learn body. So I just created a class to do that. So it's specifically for off-label, but we do full face as well. And then somebody approached me after seeing my Felicia is Sarah, and they're like, she's amazing. And I said, I trained her. She was 20 years old when she came to me. She's 22. And I taught her everything I needed. And people were saying, well, we don't know how to teach somebody to be an assistant. I said, I do. So I started that class. And then the sexual wellness piece came to be with working with Dr. Runnels, and he wanted me to be a trainer for him. So I trained just specifically for O-shot. That whole day is O-shot, P-shot, vampire breast lift, vampire facial, face, and hair. It's a long day, but you get certified in all of it, and it's just one day. And then I often will ask people if they want something very customized. I think my niche is more of somebody with a little experience rather than starting from the basics. So I feel as though I do better because my whole thing is I don't want to put my gloves on the whole day. I want them to be doing the work so they really get a lot out of it. And I do some business mentorship, but it's usually one-on-one. I don't do like a business class.
Right.
Because listen, I've been doing this a long time. I've made a ton of mistakes, which I don't think of them as mistakes. I feel like I've learned from them. And I'd love to share that. Like you said, I'm an open book, so I can tell you this didn't work for me. This did work for me. So that right now, that's my class load. I'd be
So
happy to entertain doing something different if someone wanted to.
for your classes, what is the email address? Is that different than your elite email, or is it the same?
Yeah, so they can just email admin@myelitemedspa.com.
Okay.
It's also on our website. There's a link to our classes.
And what's the website?
myelitemedspa.com.
Okay. Perfect. Just so the listeners can look that up and find that if they are interested in doing one of your classes or, coming to train with you. So how else can listeners find you? I know you mentioned your Instagram handles. Will you mention one more time where they can find you online?
Absolutely. So my own is at Dr. Joelle Lieman. Our main spa is at My Elite Med Spa, and you can DM either one of those, we'll respond. And the training academy is at my.elite academy.
Perfect. And I think on TikTok, I think it pops up for just like if you type in sexual wellness, like
Oh, yeah.
you like pop up. So you're there, girl. You've got the marketing handled. So anywho, so thank you so much for coming on, Dr. Lieman. And I appreciate you. I can't wait to see you in person and give you a big hug. I appreciate you telling us about your journey and helping all of the listeners. And I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, kindly share it with your friends on social media. Also, don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners find us. Until we meet again, wishing all of you an amazing week ahead.
Thank you so much.
Thanks. Bye-bye.
Thank you for joining us this week on the Business of Aesthetic podcast series, brought to you by our gold sponsors, MRP and Equa Marketing, and silver sponsors, Lengea Law and ProNox. Would you like to join our growing group of aesthetic industry experts and get featured on the Business of Aesthetics podcast? Or do you know someone who would love to share their strategies for growth in the aesthetic business, providing quality patient care or their clinical expertise? Head over to www.businessofesthetics.org, podcast, show, and apply to be featured as a guest on the show. Remember to subscribe to this podcast on iTunes, Google Play, Amazon Music, or wherever you listen. If you would like to engage with today's speakers, or any of our past speakers, join our Facebook group or LinkedIn group by searching for Business of Aesthetics. Thank you, and have a great day.